Good evening, everybody. As you know, my name is Chris Ely. I've just been presented. Thank you very much, Ben. I'm the branch chair for IOSH Staffordshire Branch, and I'd like to welcome you all to our first webinar. We wanted to ensure that we continue to undertake branch activities in, of course, the present circumstances as much as possible, and we saw this as the very best way for branch meetings to be held until further notice. We at Staffordshire Branch are proud to produce professional, relevant, engaging and thought-provoking events for our members, and this is certainly one of those. We exist to support our members, the profession and the wider world of health and safety. This work forms part of the 3 pillars of IOSH Work 2022 to influence, enhance and collaborate across the industry as part of IOSH's 5-year strategy to shape the future of health and safety. This event has been born from the requirement to deliver events related to IOSH Work 2022 from the requests that we receive from branch members left on our event feedback forms, and also the need for topical, interesting and engaging subjects. So we really do consider a wide variety of sources before we engage on branch events. I'd like to introduce you to a gentleman who will surely deliver this quality of service and thought-provoking, interesting presentation. And so I'm thrilled to hand over to Alan Millband, who's been very kind to support this. Alan is a partner from Percival, LLP, to present for you tonight sentencing in health and safety cases and its use as a compliance tool. So thank you, Alan, and over to you.
Yes, good evening, everybody. Hope you can all hear me satisfactorily. I can't see you, but perhaps that's no bad thing. You won't be able to put me off quite as easily as you do when I actually present at branch, which I've done several times. For those of you who've seen me present before, sorry you're having to put up with me again. For those of you who haven't, then it's going to be a wholly new experience for you. But thank you for the introduction, Chris. I should add I'm Alan Millband. I'm a vowel short of a politician in my surname. And I am by trade a health and safety and regulatory lawyer. Specialised subject of mine is the health and safety law in the minerals and extractives industries. And I edit and co-author the Institute of Quarrying's textbook on health and safety law in quarries. I am also a guest lecturer at the University of Derby on the Minerals Management course, where I lecture in health and safety law and compliance. My day job is in advising organisations and individuals in relation to health and safety law, and sometimes defending them in prosecutions and challenging enforcement action on their behalf. But that's enough about me. Today's presentation is going to take a look at something which has been a hot topic for a number of years now, and that is the definitive sentencing guideline in health and safety and other cases. It is, of course, ultimately the mechanism that the courts use in order to pass sentence on health and safety offenders. But it is drawn in such a way that actually, if you drill down into it, you can see that there are some very useful, practical measures to be gleaned from it. And that's what I'm hoping to explore today, and looking forward to getting some questions on that subject from you later. The presentation is not going to include the B word, which was frankly raised in a great many presentations until recently, but as you know that the B word has now been replaced by the C word, which is to say coronavirus. I've no doubt that someone will wish to ask a question or two about that at the end, but it is not going to be a prominent feature of this presentation unless you suddenly see me start to cough and splutter and collapse to the floor. But if that happens, you may or may not be relieved to know I've got some help close at hand. To the meat of the presentation then, health and safety offences, as I'm sure you all know, and this is taken from the wording in the guideline, are concerned with a failure to manage risks to health and safety. And it has never been the case, this is not just something that dates back to the sentencing guideline, but it's never been the case that the offence has required proof that the offence caused any actual harm. So a health and safety offence is about creating a risk of harm. And the quotation on that slide is drawn from the definitive sentencing guideline. So that was the quotation that I was referring to from the Sentencing Council. And this is the next slide that I want to go on to, because I do want to take a little step back in history. I wanted to find an appropriate image to convey a historical position, and I hope those who are watching will forgive me for having used the history professors from the Baddiel and Newman sketch show of a couple of decades back. That's perhaps something of an in-joke, although it may mean something to one or two of you. But let me just go to the position before the introduction of the definitive sentencing guideline. So this is how it used to be before the 1st of February 2016. When the courts came to sentence health and safety offenders in those days, there were no guidelines. There was no sentencing guideline to assist them, nor was there any tariff to refer to which set particular figures that would be applicable depending on the nature of the offending. What tended to happen was that the courts were on their own in trying to arrive at the right figure. And how they would do that is often be addressed as to fines handed out in similar cases. And that, of course, was a little bit of a game, because the prosecutor would try and find cases which he would claim to be similar, he or she would claim to be similar, and which would reflect high fines imposed. And the defence lawyers would try and find similar cases in which comparatively low fines had been given. And in the end, it was for the court to try and decide what would be both sufficient to punish the health and safety offender and send a message out into the marketplace that health and safety offending was a matter of serious concern for the courts. But prior to the 13th of March 2015, the maximum fine that could be imposed for a health and safety offence in the magistrates' court was £20,000, and it wasn't too long before that it was as low as £5,000. And so the art for the defence lawyers in those days was to try and make sure that the magistrates' court retained jurisdiction of the case. And how it happened was that a great many cases were being concluded in the magistrates' courts with very low fines being imposed on some fairly wealthy offenders. And along came in 1999 two Court of Appeal cases in quick succession. The first, the case in Howe, and the second, the case in Friskies. And effectively, the decision of the Court of Appeal, as recorded in those cases, was that unless the magistrates were sure that their sentencing powers were adequate, then they must commit the defendant, the offender, to the Crown Court to be sentenced in front of the Crown Court judge. And the case of Howe explained how the courts must look at a number of features in the case that either aggravated the offence or the offending or mitigated it. And these were collectively known as aggravating and mitigating features. And the Friskies case there said that not only should the prosecution and defence try and agree what were the aggravating and mitigating features in a health and safety case for the benefit of the court, but that they should write these down in schedules and exchange them. We no longer have Friskies schedules in cases, but the sentencing guideline, as I'll explain shortly, does take these kinds of factors into account. So, for example, a bad health and safety record or cutting safety measures with a financial motive would be aggravating features of a case, whereas a good health and safety record and more an error of judgment than a systemic failure for example, would be good mitigating features. But the reality was, however one viewed the nature of health and safety law, in other words, that it was directed towards risk, not outcome, the reality was that the courts were greatly influenced by what actually happened as a result of the breach of duty. And I think it's fair to say that as a general rule of thumb, if two offenders were before the court for, let's say, pretty much the same offending, but one of those offenders had caused fairly significant injuries to an employee or a contractor, whereas the other offender could have caused such harm or injury, but actually had had a near miss, then the former offender would have been sentenced much more harshly than the latter. And the reality was that in health and safety offending, it was always playing catch up with other kinds of cases in which either there were sentencing guidelines or the courts had taken both a more sophisticated and harsher approach to sentencing. And as was frequently said in respect of health and safety cases, at least up to 1999, that you were often better off as an offender killing people in terms of the financial punishment that you will get than if you were to commit an environmental offence that killed fish. So the reality was that there was a general perception that health and safety offenders were not being punished sufficiently. They were not having high enough fines or other sentences imposed on them. A word about a sentencing guideline, about sentencing guidelines in general. There is an extract there on that slide, I hope it's changed, from the Coroners and Justice Act 2009, section 125, subsection 1, which says that every court must, in sentencing an offender, follow any sentencing guidelines which are relevant to the offender's case, and B, must, in exercising any other function relating to the sentencing of offenders, follow any sentencing guidelines which are relevant to the exercise of the function. And that applies unless the court is satisfied that it would be contrary to the interests of justice to do so. So in other words, what that is saying, if there is a sentencing guideline, if there is one, and it's applicable to the offending, then the court must follow that guideline for sentencing purposes, unless it's satisfied that it wouldn't be in the interests of justice to do so. So, for example, in health and safety cases, as a general rule, it's going to be in the interests of justice to follow the guidelines, so the sentencing guideline will seldom be departed from. It is possible, I suppose, that an offender may be treated much more leniently than would otherwise be the case under the guideline if, for example, he or she, himself or herself, had been injured in the same incident or had caused the injury of someone to whom they were related, for example. But what we should do for present purposes is assume that in health and safety cases, when it comes to the sentencing of an offender, the guideline is going to be followed, let's put it, religiously. Forward to the 1st of February 2016 and the introduction of the definitive guideline, the first ever definitive guideline applicable to health and safety offences. Or as you will see, this sentencing guideline is a Sentencing Council publication applicable to health and safety offences, corporate manslaughter and food safety and hygiene offences. But for the purposes of this evening's presentation, I'm just going to focus on the health and safety offences element. It cannot apply, of course, until such time as there is a convicted offender before the court, which is to say that obviously the court is not going to make any reference to it unless the health and safety offender has pleaded guilty or been found guilty following a trial. The guideline applies, as maybe you know, to both organisations and to individual offenders. And what this sentencing guideline does is it takes the court through a series of steps, 9 in all, that the court must take in order so as to arrive at the appropriate sentence to hand down. And the guideline itself, I'm sure quite a few of you, possibly all of you even, are familiar with it, if not in detail, then at least in outline, has a particular structure in which there are also ranges for potential sentences. That's ranges for fines for organisations and fines and other sentences that can be imposed on individuals. And within those ranges, there are starting points. So there are various tables that are set out in the guideline that the court, having gone through preliminary steps, references in order to try and determine the applicable sentence. And the guideline specifies those ranges for each type of offence, and in respect of each offence, there are category ranges for each level of seriousness, and within each category a starting point for the sentence, from which the court, once it's latched onto the starting point, will move up and down the potential range depending on certain features in the case. And the guideline then allows the court to make various adjustments in order to finalise the sentence, one example of which is that if the offender has been convicted of a number of offences, then the court can invoke the totality principle, in which it imposes, for example, a single fine in respect of all those offences. And the final adjustment is that the court has to step back and review what it proposes to impose by way of a sentence and make sure that it remains happy with that sentence, having gone through all of the steps. Now, I appreciate, everyone, that at the moment this just seems like a simple narrative of the sentencing guideline, and indeed at this point it is, but it's necessary to go through this in order to start exploring the key points of the presentation, and I will come on to those shortly. I'm also conscious of the fact those of you who've seen me present before are probably used to me trying to introduce a little bit of levity into the proceedings, but I can tell you I'm not going to trouble you with too many of my jokes, invariably bad, in relation to this presentation, because I can't see the audience reaction, and so my default position will be that I would just be making wisecracks to a stony silence, so I hope you'll forgive me for that. So to carry on with the somewhat turgid approach to the sentencing guideline, the very first step that the court must take in respect of the convicted health and safety offender before it, and in this particular matter I'm going to focus on how the court deals with organisations rather than individual offenders. So assume that it is a company of any size at the moment, but a company that is the convicted offender before the courts, which most often it is in health and safety offenders, at least a company or some other body, corporate or organisation. The first step that the court has to take is to determine what the offender's culpability was in relation to the offending. And you'll see that there are 4 categories there. That table is unashamedly copied and pasted from the guideline itself. So it ranges, the culpability ranges from very high to low. Very high culpability being where the offender deliberately broke or showed flagrant disregard for the law. Right at the other end of the scale, a low offender who's one who didn't fall short of the appropriate standard. For example, because significant efforts were made to address the risks, although they were inadequate on this particular occasion, and there was no warning or circumstance indicating the risk to health and safety that materialised. And you'll see also reference there to the fact that the failings were minor and occurred as an isolated incident. Between those are the high and medium categories. Medium is one that sits somewhere between high and low. But what I would do is invite you to consider what constitutes high culpability in the sentencing guideline. And it says there, the offender fell far short of the appropriate standard. For example, by failing to put in place measures that are recognised standards in the industry, ignoring concerns raised by employees or others, failing to make appropriate changes following prior incidents, exposing risks to health and safety, or allowing breaches to subsist over a long period of time. Now, can you please try and hold those elements of high culpability, because they are particularly relevant to the presentation as we move forward. Once culpability has been established, still as part of the first step, the offence category, the court must decide the appropriate category of harm, which is to say, the seriousness of the harm that the breach of health and safety law risked, and the likelihood of that harm arising. And you'll see there that the court does this by reference to a table. And along the horizontal at the top of the table is the seriousness of the harm risked. This could be, at its highest level, level A, a risk of causing death, physical or mental impairment resulting in lifelong dependency on third-party care for basic needs, or a significantly reduced life expectancy. Level B, the in-between one, is physical or mental impairment not amounting to level A, but which has a substantial and long-term effect on the sufferer's ability to carry out normal day-to-day activities, or on their ability to return to work, or a progressive, permanent, or irreversible condition. And level C, the lowest of the harm risk levels, is that which applies if what was risked doesn't otherwise fit as a level A or a level B matter. And then, having looked at the level of the harm risked, the court uses the table, having asked itself whether there was a high likelihood, a medium likelihood, or a low likelihood of the harm actually resulting, actually arising. And by cross-referencing those matters, the likelihood of harm ones on the left-hand side of the table with those on the levels which run horizontally across the top, the court arrives at a harm category. So just to recap, by going through step one, the court has decided how culpable the offender is, and the seriousness of the harm risked and likelihood of it arising, which is to say the harm category. Now, there are additional harm factors, and again, please bear these in mind. It's important as we go forward. First, whether the offence exposed a number of workers or members of the public to the risk of the harm. The greater the number of people, the greater the risk of the harm. And also there, as you'll see, whether the offence was a significant cause of actual harm. In other words, if actual harm did follow, whether the offence was a significant cause of it. And it says there, consider whether the offender's breach was a significant cause of actual harm and the extent to which other factors contributed to the harm caused. Notice there it says that actions of victims are unlikely to be considered contributory events for sentencing purposes. Offenders are required to protect workers or others who may be neglectful of their own safety in a way which is reasonably foreseeable. In other words, the sentencing guideline is saying in simple terms, you can't defend the harm position by, or you will be unlikely to defend or mitigate the harm position by contending that the person that was harmed in some way brought it upon himself or herself. And again, these factors are significant because they allow the courts to move to the next harm category up if those factors in 1 and 2 on that slide actually exist. So having gone through step one and decided on culpability and harm, the court then must establish a starting point and category range. Now, a starting point in these circumstances, remember we were looking at corporate offenders, is going to be a monetary starting point, because there is no other sentence that can be handed down on an organisation other than the financial penalty when it comes to health and safety offending. There are one or two orders that can be made against the corporate homicide offender, but they're not relevant to this presentation. So in step two, there are a number of tables. And in respect of organisations, there is a different table depending on what we often term as the size of the organisation. And that's whether the organisation is micro, small, medium or large. There is a category of very large size offender, but there is no table in the guideline for that kind of offender. The court has to look at what would be a fine applicable to a large organisation and then decide by how much it might increase that on account of the offender being a very large organisation. But the categories are stated there. A micro organisation has an annual turnover up to £2 million. For small, it's between 2 and 10 million. Medium, between 10 million and 50 million. And large is 50 million and over. Very large is deliberately not defined. There are occasions when the prosecuting authorities in health and safety offenders contend that organisations should be viewed as very large if, for example, their turnover reaches £100 million or more. There's another school of thought that says that actually this category is reserved to offenders whose turnover runs to billions rather than millions. But either way, the category is not subject to a table and will largely depend on what the court or the judge makes of it. The tables in relation to individuals, I should perhaps add at this point, are generally refer to fines as percentages of weekly disposable income, but also include such things as community orders and potential custodial sentences. But in the guideline are these tables, and what I've done here is just copied and pasted the table that applies to a small organisation. And a small organisation, if I can remind you, is one that has an annual turnover of between 2 and 10 million pounds. And you can see that on the left-hand side, the court's view on culpability will be married with what it believes to be the appropriate harm category. And then moving over to the centre and to the right of the table, this will give the court a starting point for the fine and a range that shows what the lower amount of the fine might look like, and leading up to the more eye-watering figures on the far right, which are at the high end of the range. So effectively, the court has to latch on to a starting point and then move up and down the range according to various features that might exist. So, also in step two, and to guide the court in moving up and down the range, and again, no apologies for the wanton copying and pasting direct from the guideline, are factors increasing or decreasing the seriousness. And the court must decide which of these, if any, exist, and will shift up and down the range in accordance with them. These are not dissimilar. If you remember my having referred to the aggravating and mitigating features that were covered in the Howe and Friskies cases of 1999, these are similar, and these lists are never intended to be exhaustive. The court can include as either an aggravating or mitigating feature, a factor increasing or decreasing seriousness, something that's not in the list. But there was not, under the previous law, this category of statutory aggravating factor that the guideline introduced in February 2016. And that is that previous convictions, having regard to the nature of the offence to which the conviction relates and its relevance to the current offence and the time that's elapsed since the conviction, such a conviction, a relevant conviction, falling into that category, is a statutory aggravating factor, meaning that the court must treat it as an aggravating factor, no discretion there, and that will mean that the court will move up the fine range to allow for that. And you'll see there that other aggravating factors include such things as cost cutting at the expense of safety, deliberately concealing the illegal nature of an activity, a poor health and safety record, falsification of documentation and licenses, that kind of thing. Whereas factors that reduce the seriousness would be if the offender has no previous or relevant or recent convictions, took steps voluntarily, in other words, absent an improvement or prohibition notice to remedy the problem, and that there was a high level of cooperation with the safety authorities' investigation beyond that which will always be expected. In the days of the mitigating features to which Howe and Friskies referred, simple cooperation with the investigation was enough to carry the day for an element of mitigation. But cooperation to a degree is now expected, and it's only cooperation over and above that which is expected that hits that particular mitigating feature. Although you'll see that there is a three-way factor at the bottom of that list: self-reporting, cooperation, and acceptance of responsibility. Those three combined will constitute a mitigating factor, a factor reducing seriousness, and for that the court can move back down the category range again. Again, can I just say at this point that if you know all of this, I am sorry, but it is necessary by way of introduction to the thrust of the presentation. I want you to consider again what was said about low culpability offenders. A low culpability offender, excuse me, was one that had made significant efforts to address the risk, where there were no warnings and there was no circumstance to alert that offender to the risk, that the failings were minor, and that it was an isolated incident. And because this equates to nearly compliant, in other words, you were very close to complying with the law, this category of offender, the low culpability offender, is the least likely to be prosecuted, because other kinds of enforcement action are likely to be seen as sufficient. For example, the health and safety executive serving improvement or prohibition notices under notification of contravention, perhaps to identify the breach and to secure future payment of a fee for intervention. So the low culpability offender may face prosecution if there was a particularly high harm category, but if it's not in the higher of the harm categories and is a low culpability offender, it is unlikely that it will be prosecuted, because it is not the kind of offender that the HSE will feel any particular need to draw through the system, particularly if it's being cooperative with all elements of the investigation and any remedial action needed. So you have a duty holder under health and safety law. Let's say it's the organisation in this case, doesn't really matter what is happening, but it is minimising its health and safety risks because this duty holder has effective and implemented health and safety arrangements. appropriate and sufficient responses to warnings and the like, and every incident is managed such that it is isolated. Now, let me explain the point that I'm trying to make here. If you are advising an organization, either your own organization or if you are a health and safety consultant or service provider advising others, if you can encourage or move your organization, your client, the duty holder, to a position in which that organization has effective health and safety arrangements which have been implemented and which are being observed in practice. And if that organization, when there are either warnings about an unsafe state of affairs or something happens, there is some circumstance to indicate a risk, if that organization has an appropriate and sufficient response to those, then again, it is placing itself in a position where it would be, if it were an offender, a low culpability one. Likewise, health and safety incidents that the organization manages in order that they are isolated and not things that repeat or at risk of being repeated, again, move it to a category where if it were to be prosecuted as an offender, it would be a low culpability one. And as I've said before, and as I emphasize, as a low culpability offender, the reality is that unless some very serious harm indeed was risked, the health and safety executive or other safety prosecuting authority is more likely than not to take the view that this is not an offender that should be or needs to be prosecuted in respect of the offending that the safety authority believes has been committed. So in looking at potential compliance, if you take a view on what would constitute a low culpability offender and mindful that that kind of offender is the least likely of all the offenders to be prosecuted, then what you are effectively doing is saying that if I can get my organization or the client or organization that I advise to a position where if it did offend, it would be a low culpability one, then what effectively I have done is to use the sentencing guideline as an aid to understanding what constitutes a low culpability offender and to taking my client or my organization to that region, that area in which it's offending would be low culpability. So to try and move the example and to demonstrate further how the sentencing guideline is actually a practical compliance tool, you'll recall that earlier I asked you to think about what constituted the high culpability offender, to note what that means. And I'll remind you by reference to this slide, the high culpability offender falls far short of the appropriate standard, for example, because of an absence of measures that are recognized standards in the industry, because of ignoring concerns raised, or not making changes following some prior incident, or allowing a breach to persist over a long period of time, or a high culpability offender is one where there was a serious and or systemic failure to address health and safety risks. Now, high culpability carries an extremely high likelihood of enforcement action and a high likelihood of prosecution. And that is irrespective of the harm category, although the likelihood of prosecution increases according to how much the harm category increases. Now, medium culpability of offenders, as I've said before, are those who fall between high and low, but are still far more likely to find themselves on the wrong end of a prosecution than the low culpability offender in similar circumstances. But what it's telling you is that if in relation to health and safety compliance, in relation to abiding with health and safety responsibilities and complying with duties, that if these features that would constitute high culpability exist, then it must be more likely that the organisation will be prosecuted, because the court takes the view that the failings listed there are matters of high culpability. So, exploring that further, how does one avoid the potential high culpability situations? I've broken this down a little bit in this slide and the next. I hope it's helpful. First of all, if the organisation follows and utilises recognised industry safety standards, then that will mitigate against it being a high culpability offender. And what that means is that for compliance with industry standards, unless it knows them anyway, it will do things such as looking to guidance materials in deciding how it should meet its duties and responsibilities under the law. Now, forgive me that the quality of the images there are not particularly great, but I have included certain guidance materials, which I dare say many of you, if not all of you, are familiar with to some degree or another. And these materials effectively are establishing or showing what has been established as the recognized safety standards for those particular industries or those kinds of operations within industry. So being aware of the guidance, what it says and the like is very important. And bear in mind that some guidance is directed towards matters of a more general application. But as I'm sure you know from your own experience, that there are many published very specific guidance materials that might apply to very specific kinds of machinery and tell you what needs to be done in terms of achieving the safe operation of such machines or the safeguarding of them. So by knowing what the industry standards are and applying those standards, the organisation mitigates against it being found to be a high culpability offender if something goes wrong. Now, guidance is not the law, as you all know, but it actually directs you to how you might apply with the law. And if you follow it, the odds are, as long as you know what the guidance is, that you will be putting in place the relevant industry standards, or at least the duty holder will. But also those standards are covered elsewhere. They can be found, for example, by being members of trade associations. I sit on the Health and Safety Steering Committee to the British Precast Concrete Federation, where incidents, compliance issues are shared within the organisation, and where that organisation actually contributes to the publication of guidance relevant to various sectors or operations within those sectors. So associations can be a valuable source of information for applicable industry standards, both for you as professionals and advisors and for the organisations direct. Dialogue with others in the same industry is no bad place to be if the organisation is not acting in isolation, but is happy to meet with other similar organisations and the senior management teams to discuss various issues. That is another way of knowing that industry standards are not being met. And of course, a lot of duty holders quite rightly rely on people such as you as health and safety professionals to direct them towards the relevant industry standards. So by adopting and embracing industry standards, you're not going to fall far short of the compliance bar by failing to put those standards into place. And of course, it's the failure to put those standards into place that reflects high culpability. As regards concerns raised, the high culpability offender just does not respond either adequately or at all to those concerns, and that's recognised in the guideline. So to break this down into some other component parts, the organisation needs to be aware what a concern is. The courts take a more liberal view of concerns, if you like, a more liberal definition. So it isn't simply a letter that is, or a communication that is fairly and squarely identifying a particular unsafe practice and or a suggested means of putting something right. The courts might view a concern as being something that is raised and discussed as giving rise to a potential risk in something like a health and safety committee meeting. So it is incumbent on the organisation to understand that concerns can be raised in different ways, but when they are, there should be a measured response to them. Now, the reason that I say a measured response, ladies and gents, is because it's not every concern that's raised that requires the organisation to take immediate or even any steps to put right. The concern has to be judged in its own right, and the response has to be determined. And again, it may be a case of needing some professional steer on that. So I'm not saying for a moment that you're automatically a high culpability offender because even a concern that turned out to have been of no great importance was something that wasn't addressed properly. But it is important to make measured responses to concerns that are raised or which come to the organisation's attention. And I also think it's very, very important that in relation to concerns, given the widest possible definition of those, that the organisation is well advised to document the concern, the action that it believes was necessary, or in some cases not necessary in response to it, and also making sure that the action is properly closed off. In other words, something documented to show that it was that it has been taken. It's also good practice, I think, to get sign off from the person who raised the concern in the first place. In other words, getting back to that person to explain either why something hasn't been done and asking him or her to confirm that they're okay with that, or actually explaining to them what did finally happen, even if you think they know it in the first place, what did finally happen in response to the concern that was raised, and whether they themselves are of the view that it has been adequately actioned and closed off. Following these practical measures in the working environment in the organisations will help mitigate against a finding in the event of the organisation being an offender that it was a high culpability one. And still on the subject of high culpability situations, you avoid high culpability if you do make changes when they are necessary. But also the organisation needs to have the means to swiftly identify and correct breaches of, certainly material breaches of health and safety law, because you'll recall that in the definition of high culpability offender, one of those is that there is a breach that has persisted for a considerable period of time. Now, with the best will in the world, if the senior management of an organisation are completely unaware of a breach in circumstances where you couldn't reasonably expect them to find out, that is not a situation where there has been an allowance of the breach persisting over a long period of time. But when breaches are identified, they do need to be rectified and rectified swiftly, because if that doesn't happen, then the offender does run the risk of being a high culpability one. And so that's why I've put there that the guideline is really directing the offender to have the means by which it swiftly identifies and corrects breaches. Now, this could be through gap analyses, audits, regular audits of the workplace and workplace practices, and the like. But effectively, what the guideline is saying is do these things and you will avoid high culpability. And as we've said before, if you're a low culpability rather than a high culpability offender, you are maximizing the chances that any action taken against you will not stretch to prosecution. Now, managing the risk of serious or systemic failure can be a significant challenge, as I'm sure many of you are aware. Systemic failure is not always a readily understood concept, so I hope no one will mind, and especially those of you who've got a firm grasp on the concept, I hope you won't mind that I've actually suggested a definition. It's neither an exhaustive nor the only definition, but I think it's a helpful one. A systemic failure is not one related specifically to an event, but to the manner in which an organization or project is managed, organized, and or communicated. And a systemic failure not identified and acted on risks the same or a similar failure occurring again. And I've just included on the final line there where I've said that many health and safety events have some aspect of systemic failure. That's not simply a throwaway observation by me. This was actually recorded in the CIRIA Loughborough University joint publication for HSE, Preventing Catastrophic Events in Construction. So systemic failure is the failing of the organization, and let's put it fairly and squarely, the failing of the organization's management to manage and organize itself properly to ensure shall I say, the systemic failure is where it hasn't managed or organized itself properly in such a way that it's been able to identify and act on risks. And in that way, those risks remain potential risks over a period of time without being properly addressed and without having the right control measures implemented. Now, a word about very high culpability offending. I don't think there's a lot that we can teach any duty holder who might be inclined to break health and safety law deliberately or simply have a flagrant disregard for it. But I just thought it was worthwhile because it is a cultural matter, in my view, identifying some of the causes, which I do on that slide. So those causes include such concepts as believing that the rules don't apply to me as the potential offender, a sense of pressure on time or resource to which I then subrogate health and safety compliance, cracking on with the wrong equipment where right equipment isn't available, a lack of understanding of a situation or of what the law is there to do, or indeed in some cases what the law says. Cost cutting, that's one of the most significant ones, and assuming that the experience of an employee or a worker is the primary safety measure. In other words, an organization or a person that feels that not keeping someone safe was justified because they had, for example, done the job for many years without harming themselves. So high culpability organization offenders are going to receive very high fines indeed. And the individuals who are high culpability offenders risk custody irrespective of the harm category. The only practical compliance tool I can give you all arising from this one is that because it's a health and safety cultural matter, it has to be combated by creating the right kind of culture in the organisation. But if there are individuals at the very top of the chain, those in senior management, who have any inclination whatsoever to deliberately break or flagrantly disregard health and safety law and compliance, I suspect you as the professionals advising them or the organisations have a nigh on impossible task. But I thought it was worthwhile including some commentary on that in any event. You'll be pleased to know that I'm reaching the end of the presentation, but I just wanted a quick word on factors increasing seriousness, because these place the offending in a degree of context. And I do refer there to the strategy of time and distance. You cannot change history. So if the organisation has a poor health and safety record or a previous relevant conviction, there's not much you can do to erase that. How you deal with it and how the organisation deals with it is to put as much possible time and distance between that poor health and safety record, between the previous relevant conviction and the present day. The longer you put time and distance between that and the present day, the less likely it will increase the seriousness of the offending to any great degree. And then finally, of course, other factors that increase seriousness, well, these are very much down to the mindset of the offender. So cost-cutting, obstruction of justice, which I occasionally refer to and apologise to anyone it offends as chinning the health and safety inspector. But it goes beyond that. Obstruction of justice is where one manipulates in order to try and prevent a prosecution by anything that would not constitute lawful or fair means. But concealing an illegal activity and falsification of documents, those things are, in my view, a demonstration of the kind of organisation or individual that you can't necessarily do a great deal about. So before we get on to the Q&A or indeed anything else that you wish to discuss, just by way of roundup, everyone, the definitive sentencing guideline is probably as well used for anything else as by showing what can happen in terms of fine and punishment if you don't comply with your duties as a duty holder under health and safety law. But what it also shows us is what the courts view as things that make offenders most culpable, and where the courts see harm scenarios and how they categorize those. And by using those features in the guideline to militate against them arising, we actually have some practical guidance on where the duty holder needs to be taken to in order to be effectively managing risk. And that is by either ensuring complete compliance with health and safety law at all times, or the next best thing, which is making sure that if you don't, then you do so in circumstances where the harm risk is not great, that the likelihood of that harm materializing is not particularly high, and importantly, where the culpability is low. So ladies and gents, there you are. That's the end of the presentation. I hope it provokes a few thoughts. I hope it's prompted a few questions, which no doubt I'll get to hear about in the next few seconds. Thank you.
Well, Alan, fantastic, engaging presentation. It's obvious that your present of some experience, because your presentation was absolutely fantastic. Certainly I can see you've got a very dry sense of humour, and I think we all like a bit of that, particularly this time with coronavirus. But really appreciate your presentation there. It's I think it's very important to consider this. I'm very conscious of Plan, Do, Check Act, and HSG 65 are very important that those that are involved with management of health and safety understand the responsibilities and the size and scale of the job, but without, in a sense, trying to scare those managing or being involved in management of health and safety. I think it is very important to recognise the seriousness of any organisation, for that matter, or individual, if people don't get things right, particularly if they don't get things right because they're being lapsadaisy, if they're not buying into managing health and safety properly, or for that matter, plainly negligent. It's a very difficult job for us in health and safety, I think, to sometimes manage that and sometimes be the pig in the middle. But I think this is a very important part of the conversation. I think you'll agree. Whilst we're waiting for a few questions, and I certainly encourage people to pose questions for Alan to answer. Really good opportunity to ask those now. But yeah, it's a really important discussion, Alan, isn't it, in the scheme of things, to get people on side and to understand the ramifications of health and safety and, as we say, the sentencing guidelines.
Yes, I think, Chris, what I would say, and in relation to what's gone before, is that we should never, across the board, assume or stop striving for total compliance. But there is also, I think, and I hope no one will be offended or think any less of me for saying so, that there is always the possibility of the duty holder being in material breach, and of that being in circumstances where the safety authority, be that the HSE or maybe a local safety authority, may contemplate a prosecution. I don't believe that you can always do everything or always be expected to do everything that would never expose you as a duty holder to the risk of being a low culpability offender. But I do very genuinely believe that making sure you are not a high culpability offender or potentially high culpability offender is something that is attainable, that is achievable, and which not only should the organisation work to make sure that it doesn't fall into that category of offender, but that it must do that and can do it. So I would never go as far as to say, hand on heart, that you can expect 100% health and safety compliance all the time. But I do not see why you cannot place yourself in a position where 100% all of the time you would not constitute a high culpability offender.
Yeah. I'm very conscious when I was a food environmental health officer that there was the element of not the accident, but exposing those to risk. That is a real element of the sentencing guidelines as well, isn't it, Alan?
Yes, it is. The sentencing guideline makes quite clear the historical position, which was that, and by the way, this is, as you know, Chris, it's not just a health and safety guideline, but it applies to food safety and hygiene offenders as well. It makes the point that it has always been the case that health and safety law, food safety and hygiene law, was directed to the risk. And the offence was in failing to manage the risk and thus exposing people or others to a risk of harm. And again, outcome could be a demonstration of just how much harm was risked, but there never actually had to be outcome. And for example, to go back to the area in which you used to operate, as you know, poor food hygiene and practices still rendered lots of organisations open to prosecution, and indeed there are a great many convictions, even though the prosecuting authority could never actually come up with evidence to show that any one individual had actually been made ill or suffered some other health consequences as a result of the breach.
Mm. Yeah, it's a fair point. So I think it's something definitely to consider. I remember reading when the sentencing guidelines came out, talking about perhaps an unguarded edge or an exposed edge where staff members were perhaps walking past it every single day in a big organisation. That could still turn out to be a very hefty prosecution. So I know that's turning it around to health and safety, but something to consider, I think, as we look forwards and actually look backwards at a copy of the sentencing guidelines to make sure that we are equipped as best as we can.
Yes. Also, the sentencing guideline is not wholly unrealistic, because what it does recognise, especially in relation to harm, is that what the court must do is it must look at the offence. That's the offence for which the organisation or the individual was convicted, and must ask itself, what was the harm that what was the harm to which people were exposed and the likelihood of that harm from the offending. Now, this is something that even the courts don't always get right, and sometimes you can find yourself having some moderately heated debate with district judges and the like in relation to it. And it is that the likelihood of harm isn't just some sort of general notion of harm from an unsafe set of circumstances. Let me give you an example to try and illustrate that. As a general proposition, if I dig a very, very deep hole, and I don't guard it, as a general proposition, someone could fall into it and die. If my offending was digging a very deep, unguarded hole in the middle of a field, then the court would need not to look at harm as some sort of general concept of what kind of harm comes from digging a hole, what kind of harm routinely happens from a crane falling over, but it must look at the offence and say to itself, in respect of that offence, what was the harm risked? What that means is if I dig a very deep, unguarded hole in the middle of a field, I am not giving rise to the same likelihood of harm as if I were to dig it in Stafford Marketplace.
Yeah, totally get you. Excuse me, frog in my throat. Not COVID-19, I've got to say, just dry throat.
Well, we've got your word for that, Chris. Thanks.
Yes, well, I'm definitely a distance from you, Alan, so I should be okay. But that's a really good. It's really good putting, as you've put succinctly there, the point to the example. Sorry, you've opened up the example, from the sentencing guidelines. I think that's very valuable. Certainly, I think a lot of us, certainly those in construction, will probably reflect on that. So that point is appreciated. So yeah, thank you for that. Going back to the questions, we've got two questions. The first one is, is the recording available after this? The answer is definitely yes. It's going to be put on the IOSH Central YouTube page, and also I'm pleased to say on IOSH Staffordshire Branch's YouTube channel as well. And so we're going to have a few copies of this after this particular recording. So definitely, for a number of people that have come along last minute, of course, racing from work and other things, trying to get toilet roll, be happy that you can be happy that you will be able to get a recording of this in the next couple of days, and I'll make sure that we publish that far and wide so that you can so you can get a copy. So that's really, really good. Certainly reflection after webinars like this, sometimes where you do the, certainly some of the learning, not all of it, but certainly having it after the event, I think is very, very valuable, certainly as far as CPD goes, and putting it into practice in school, I was going to say, into work. Well, we've got one question here. This is from Lisa. She says, with COVID-19, Alan, do you think good record keeping is important as the goals are changing daily? I think she means like the goalposts. Any tips to keep on top and doing the best to keep on the right side of the HSE? So a good old COVID-19 question there.
Yeah, I rather anticipated we'd get a question on coronavirus, irrespective of what I presented on today. And I should just ask Chris, without wanting to lose the thread of what went before, I do have some spare bog roll. And for IOSH members, I am more than happy to offer that at discounted rates. So you lot can have it for 50 quid a roll instead of the 100 that I'm charging everybody else. But on a serious note, Lisa's question, good record keeping is manna from heaven to lawyers, but not without reason. Good record keeping is proof that you are doing what you're meant to be doing, provided you know what you're meant to be doing. And sorry if that sounded a little bit confusing, but obviously if your good record keeping shows that you haven't got the foggiest about a certain control measure or that you're getting horribly wrong, then that record keeping, of course, can unknit you in the same way that any other piece of documentary evidence could. But if you know what control measures you should be putting into place, and the documentation shows that you are doing that, and provided that in respect of COVID-19 you appreciate that the guidance is shifting on a day-to-day basis, so what you're documenting today might be documented in a rather different way tomorrow. But as long as you are alert to all of that, then in answer to Lisa's question, keeping the documentary record is important. It doesn't have to go into realms of detail. I've never been a big believer in actually over egging the information. I think it can be counterproductive because it makes it difficult to understand. And also I think if ever you get into trouble over it, it rather looks like you were trying to blanket bomb your way to getting things right rather than actually going about it with appropriate method and science. But as things stand at the moment, for all employers, I would say this in relation to COVID-19. And I'm sorry if you see this as a cop-out, but if you go onto the HSE website, then there are guidance materials available, slightly different forms of guidance. So for example, if there is a different guidance for healthcare and care professionals than from the rest of us. But if we're looking at advice to employers generally, the HSE website has a link to the Gov.uk website. And the Gov.uk website has the bang up to date guidance for employers in relation to COVID-19 and what precautions should be taken. Now, the general feeling about any guidance material is, and to be honest, it's quite right, is that it is telling you how to comply with your duties and responsibilities. You can always comply with those duties and responsibilities by other equally effective means because guidance is not set in law. But my advice has generally been that unless there's a good reason why you can't go along with the guidance, go with the guidance. Because you can't do any more than follow the guidance in reality. And if you do, the odds are you will comply with the law. Because what we need to understand here is that even though we are in unprecedented times vis-a-vis COVID-19. What isn't unprecedented is the requirement that we ensure the safety of our employees to the extent that it's reasonably practicable under Section 2.1 of the Health and Safety at Work Act. So as employers, to ensure their health and safety at work, we need to identify and implement appropriate control measures. Those are very helpfully set out in the guidance. So it's HSE website, link to the Gov UK guidance, follow it, watch for it changing, introduce new measures or revise measures and revisit old measures if the guidance changes. Not easy at the moment. It's bad enough trying to comply with guidance materials that haven't changed for 10 years, as we all know as health and safety practitioners. So trying to comply with them when they are changing every 24 hours is not easy at all. But the only recommendation I can make, but I believe that it's a good and well-meant, well-advised recommendation, is get to the Gov UK webpage and follow the advice.
No, Alan, I think that's fantastic advice. Of course, a lot of folks out there engaged in this webinar are going to be thinking, well, what do we do? They're going to be having those questions posed to them. Of course, they're the point of experience, or should be, in many areas. They're going to be perhaps even concerned about that. So I really appreciate that point there. We've got two more points here. This will appeal to your dry sense of humour. This is from Reg. Reg says, Alan, thanks very much for an interesting presentation. My first webinar as well, so that's all good, isn't it? Webinar newbie like myself. Can I swap some pasta for bog roll? I would say no, because I know you now, I'm going to have it, so definitely you can't. I'm going to do some dealings after this webinar with Alan. We've got one last question here before I do my closing speech, I suppose, as far as branch chair. This is from Martin. He asks, can a health and safety advisor be brought to court for advising a consequent negligent organisation or being a fundamental part of non-compliance within that organisation? That's from Martin.
Right, Martin, it's a good question. The reality is that as employees, the Health and Safety at Work Act places a duty on us, it's under Section 7, to do what is reasonable for our own safety and that of other people who are affected. You'll also know that the Health and Safety at Work Act also places duty in appropriate circumstances on self-employed. And there is also a provision under Section 36 where if an organisation or a person's offending has been materially caused or contributed to by somebody else, then that somebody else, either as well as or instead of the organisation, instead of the duty holder, can be prosecuted. So in answer to your question, Martin, theoretically, anyone who gets something wrong as a basic proposition, and as a result someone's health and safety is compromised, is potentially open to investigation and action. But that is the very, very broad concept. The reality is that individuals in a health and safety scenario are very seldom the subject of any enforcement action through a simple error of judgment. And the reality is that they are advising the wider duty holder. And it is, of course, for that duty holder to meet all of its obligations under health and safety law. If that duty holder is a generally rubbish organisation, then if part and parcel of that organisation being rubbish is the fact that its advisor is giving it rubbish advice, then everybody is open to investigation. But if the advice that is being given is good advice, or the best advice that can be given in the particular circumstances, then every time it is going to be the duty holder that faces the responsibility there, the organisation, the employer, rather than the individual that was advising it. It is like everything else in terms of health and safety. It is viewed in all of the circumstances. And take note of Section 7 of the Health and Safety at Work Act, even if you're not an employee, because even if you're not an employee and it doesn't apply to you, it is still actually setting something of the scenario in which your offending is looked at. Because whereas the duty on employers under the Health and Safety at Work Act is to ensure the safety of employees and others, the duty on the employee is to do what's reasonable so that the employee and or others are kept safe. And what is reasonable depends very much on the specific circumstances in which that employee finds himself or herself. This is why, for example, an employee who removes a guard from dangerous parts to a machine is potentially in breach of Section 7, but will not be prosecuted the moment he raises the excuse for his conduct that his boss made him do it. And so the individual is judged on what is reasonable, and that is taking all the circumstances into account.
Yes.
In my experience, whilst rubbish organisations do try and blame individuals, and my experience of defending health and safety offenders goes back to 1988. Oh, crikey, yeah. I've just realised I've placed myself much closer to the coronavirus danger zone. But it goes back to 1988, and in all that time, rubbish organisations may have tried to blame individuals, but they've never been able to pin it on them. And the safety authorities are, believe it or not, extremely sympathetic to individuals in those circumstances. Yes. And the statistics back up that individuals are rarely subject to enforcement action unless their conduct can be viewed in total isolation, such as, for example, the gas fitter who causes a negligent and very dangerous gas installation because he or she is not gas safe.
You mentioned what is reasonable. Is it still used the example of the man on the Clapham omnibus as the reasonable person? Is that what you're alluding to as far as what is reasonable? Or has that changed?
Well, the reasonable test, of course, is the objective view. And historically at law, there were many cases who referred to this imaginary but semi-perfect near being as being the man on the Clapham omnibus. I'm not sure how you would, or how even the courts would refer to that individual today, Chris,
yeah,
except that I can pretty much guarantee there'd be no reference to Clapham and no reference to omnibus.
Yeah, I think you're absolutely right there.
What do you think? The man on the nice new estate on the outskirts of Stafford?
Yeah, it was part of the bread and butter of environmental health that you always referred to what was reasonable as the man on the Clapham omnibus, the man perhaps with the bowler hat, or perhaps not bowler hat, but the normal person on the bus. And it's a different conversation, I think, in itself as to what a normal person is these days.
Yeah, but I think in general what we can assume is that when the court is being asked to decide on what's reasonable, it's an objective test, although certain subjective elements can be brought into the equation against which the objective test is overlaid, but I don't want to get involved into the legal mechanics of that. But in simple terms, what's reasonable is that classic question: what would the reasonably intelligent, ordinary person
Considering
with
all,
completely
yeah.
independent of the circumstances and just being asked to express a view on them, what would that person think about a particular set of circumstances?
Yes, I got you. I think that's a good point to leave it there, really, as far as that goes. We don't seem to have any further questions, Alan. So, with your permission, I will see about closing with my IOSH Staffordshire part, to thank you both, both you and Ben. I'd like to thank Ben Pollard from IOSH, who's behind the scenes as we speak. He's the IOSH events coordinator and team leader. And in the very small amount of time, the small window that we've had to work with to consider change from a physical branch event, of course, to a webinar has been absolutely fantastic. So thanks go to Ben, who introduced himself at the beginning, and also, of course, to Alan Millband. I do, please forgive me, Alan, for mispronouncing or misspelling your name. Obviously, it's Alan Millband. So thank you, Alan, very much for your time, and please please accept my apologies for that.
It's not a problem, Chris. I've been called worse. I'm a lawyer, for heaven's sake.
Yes, well, my surname, of course, is Ely. There's only 4 letters. You wouldn't believe how many people want to put a H, E, an A, and other things in between the 4 letters or either end. So I'm with you on that, but my apologies nonetheless. So thanks both to Ben and to Alan for your time. I know it's getting into the evening. Of course, as a branch, we've had to postpone physical branch meetings for the next few months, or at least for the next 2, as it stands. We intend to continue to support our members using the medium and use LinkedIn Staffordshire branch pages to advertise events, and of course our IOSH branch page as well, where we use Eventbrite. I can say that next month sees us deliver another webinar. That is our hope, on Thursday the 16th of April. This is by Alan Spence from Network Rail, and information again will be shared on LinkedIn, and that's our predominant area for advertising events and other parts of our Staffordshire work. So we will advertise that as soon as we can. This webinar will shortly be uploaded to the main IOSH webinar page, the IOSH YouTube channel, and our own IOSH Staffordshire Branch YouTube channel, free for you to use. And Ben mentioned that earlier, which I mentioned now for some latecomers. We have approximately 25 other videos recorded from past events for you to use and to use for CPD. We encourage you to have a look on YouTube for IOSH Staffordshire Branch, to click the bell, and of course to receive those upload notifications, which are done periodically, so don't miss out. There's some fantastic learning tools there, including Legionella, asbestos, silica, to name but a few. And if you are a member of another branch and have been fortunate enough to attend with us tonight, we hope that you've had a good webinar with us. And if you are with another branch and don't perhaps engage with them, for instance, moved home or work, please consider contacting IOSH and change to become a part of our branch. You'll see on our YouTube videos with the complement videos that have been put on there from other members, that we have a very engaging, very informative and supportive branch, and I hope you could be part of that. So again, thank you all for attending this webinar this evening, and we really look forward to seeing you again soon. And lastly, again, I can't say enough thanks to Alan for your time to support us tonight. Thank you very much indeed. And we hope to meet you sometime in person, and be very safe and well, and we'll see you all soon.
Yeah, thanks, Chris. The food's better when you actually attend in person. Definitely.
Well, you've got an open welcome when this is all behind us to come and see us. Thank you very much.
Thank you.
Thank you.
Thanks.
Good night all.